VAC GranuFoam silver dressing application. The strength of VAC therapy with the protection of silver. The only silver dressing engineered specifically for the VAC therapy system, VAC GranuFoam silver combines the proven benefits of negative pressure wound therapy with the protection of silver, allowing the GranuFoam pores to come into direct contact with the wound, eliminating secondary silver dressing layers that may inhibit negative pressure in granulation. Micro-bonded metallic silver is evenly distributed throughout the dressing, providing continuous delivery of silver even after sizing. It provides a protective barrier to reduce aerobic, gram-negative, and gram-positive bacteria, yeast and fungi, and may help reduce infections in wounds. VAC GranuFoam silver comes in small, medium, and large. All the VAC GranuFoam dressings assist in granulation tissue and removal of exudate. Aggressively clean the wound according to institution protocol or physician order. Irrigate the wound with normal saline or solution per physician order. Note wound dimensions and pathology and select appropriate foam. Apply skin prep to parawound tissue. For patients with fragile parawound tissue, a thin layered dressing, such as KCI drape, may be applied to parawound area. Cut the foam to the dimensions that will allow the foam to be placed gently into the wound. Note, do not cut the foam over the wound. Gently rub the freshly cut edges of the foam to remove any loose pieces. Also, do not pack the foam into the wound. Gently place the foam into the wound cavity, covering the entire wound base and sides, tunnels, and undermined areas. Count the pieces of foam and annotate the total number in the patient chart. Also, annotate on drape with permanent marker. If the wound is larger than the largest dressing, more than one dressing may be required. Ensure the edges of multiple pieces of foam are in direct contact with each other for even distribution of negative pressure. Size and trim the drape to cover the foam dressing as well as an additional 3 to 5 centimeter border of intact parawound tissue. Do not discard excess drape. You may need it later to patch difficult areas. Cut a 2 centimeter hole in the drape, large enough to allow exudate to pass through the dressing. Lift the drape with your thumb and forefinger and cut the drape. Apply the track pad opening directly over the hole in the drape. Apply gentle pressure around the track pad to ensure complete adhesion. Give particular attention to the position of the tubing, avoiding placement over bony prominences or increases in the tissue. Connect the dressing tubing to the canister tubing and make sure both clamps are open. Initiate VAC therapy. In less than 1 minute of operation, the VAC dressing should collapse unless leaks are present.